Can you combine Tesamorelin and Retatrutide? Now, this is a great question that I love because stacking peptides, I think this is the future of peptide medicine. One of the things I worked on for years is getting a patent called the peptide pathway bypass, because I see peptides as just these small little expressions, these amino acid chains that signal certain genes to get turned off and genes to get turned on so that you can look, feel, and perform your best at any age. Today we're going to be talking about Tesamorelin, which is a growth hormone releasing peptide, and kind of the darling in the peptide world, especially when it comes to weight loss, obesity, diabetes, and even osteoarthritic knees, sleep apnea. Who knows what else Eli Lilly is going to have indications for, but that's Retatrutide. And so these are very distinct peptides working mechanistically on totally different pathways. But one of the similarities between Tesamorelin and Retatrutide is they both do a substantial amount of work at reducing visceral fat. And there's two types of fat. The subcutaneous is that jiggly, but the visceral fat, if you're somebody who has a stomach that's like really hard, but it's still bigger, there's a good chance you've got that visceral fat. That's fat that accumulates around the organs. And Tesamorelin and Retatrutide may be one of the biggest ways and the most effective stack that you could combine in order to get rid of that stubborn visceral fat. Well, there's no published clinical data where you can look at stacking Tesamorelin with Retatrutide. What we're going to talk about is just a mechanistic guide between what these peptides do. And as with anything, this is not medical advice. This is me sharing some of my clinical expertise and some of the work that I've done in studying these novel molecules called peptides. If we haven't met, I'm Regan Archibald. Really appreciate you being on the show. I'm the founder of a clinic called Ageless Future. We practice peptide therapy, longevity medicine, regenerative medicine. I want to share with you what I think is missing in the modern healthcare world. And I think there's more and more people looking for different insights and unique stacks of peptides. And so a question that came through, can you stack Tesamorelin with Retatrutide? And here's the data. And so if you have anything you'd like us to talk about, research, study, I would love to get your feedback. Just plug a note in the comments below and maybe tell me if you've ever stacked Tesamorelin with Retatrutide. And so let's talk about what each of these peptides actually does. So Tesamorelin, I mentioned earlier, it's a growth hormone releasing hormone, and it's an analog. And growth hormone releasing hormone signals your hypothalamus and it sends a message to the pituitary gland to produce growth hormone. And then what happens is growth hormone activates IGF-1, and IGF-1 downstream is the principal anabolic signaling protein. So that's the workhorse. Growth hormone is just kind of like, all right, I need you to do the work and I'm gonna wait and listen to the brain to see if we need you to produce more and to be a little more effective. But if you have IGF-1, what that does is it turns on this ability for you to start burning visceral fat, and it's called visceral lipolysis. So it's this targeted breakdown of fat that's deep in the abdominal compartment, some of the hardest fat to burn. If you're using Tesamorelin, one of the things you can do, and if you're trying to burn this visceral fat, is do some cold exposure, because just by jumping in a cold plunge, your body is going to go through this thermogenic regulation where your body starts burning fat more preferentially. A lot of that white fat that's very toxic and dangerous to our body, when we have cold exposure, it wakes up the mitochondria. So the white fat is just white because the mitochondria are concentrated in the center of the fat. But if you can get that white fat to turn into beige fat, now your body can utilize it as energy. Here's a study in 2014. This was double-blind, randomized, published in JAMA, Journal of American Medical Association, placebo-controlled. Tesamorelin was administered subcutaneously, 2 milligrams per day, and this was done in 50 HIV-infected adults with abdominal fat accumulation, and the course of the study went 6 months. What they found is Tesamorelin significantly reduced visceral adipose tissue over placebo. They also found that it reversed fatty liver disease, and they also noticed that there was a change in the lipid to water ratios. They showed fasting glucose had a transient, just 2 weeks, the glucose went up. Now that's something you want to be aware of on any growth hormone releasing peptides, but then it stabilized and did not persist at 6 months. Tesamorelin, it did receive FDA approval for HIV-associated lipodystrophy, and then off-label it is used in non-HIV populations. Very good results. I mean, in some of the studies they found that while they're losing the visceral fat, they're also gaining muscle, because a lot of these patients, they had muscle wasting disease as well. Tesamorelin, by the way, I've got some very interesting, well, I think they're interesting, popular videos on what tesamorelin does, some of the benefits, how it got FDA approval, and so you could walk through some of the history of it and find out if it's right for you. But I can tell you, tesamorelin is one of the most powerful growth hormone releasing peptides. It's 43 amino acid chains, so it very closely mimics the IGF-1. Okay, let's talk about retatrutide now. So retatrutide is very popular for good reason. Every time Eli Lilly has a new findings of their new Triumph studies come out, people are just drooling over what happened next. Maybe it's because it's a publicly traded company and there's some profits and incentives behind it. Outside of that, we found retatrutide to be very, very effective. So retatrutide, it activates the GLP-1, this glucagon-like peptide. It also activates GIP and glucagon receptors simultaneously. So it's the first triple agonist. First of many. There's going to be a quadruple agonist. There's going to be a whole world of these, but they're finding that the more they stack these peptides together, the better they work. So Nature Medicine 2024 did a phase 2 study. They took 98 participants with metabolic dysfunction associated steatotic liver disease. They wanted to see, would retatrutide treat fatty liver disease, fibrotic livers? And what they found is that retatrutide, when they got them up to the 8 milligrams per week dose, it reduced liver fat by 81.4% at 24 weeks, and then 81.7% at 48 weeks. So all the heavy lifting was done in just 24 weeks. Retatrutide at the 12 milligrams, it reduced the liver fat by 82.4% at 24 weeks and 86% at 48 weeks. The visceral adipose tissue was reduced by 31.5 to 48.3%, and those are very dramatic. And so if you think of combining like tesamorelin with retatrutide, because you're really looking to burn this visceral fat and regenerate the liver, I don't think there's a better combination known that has the amount of human clinical data. I think there's some other nuanced peptides that are very interesting for this, like 5-amino-1-MQ, even Sloop 332, or you could look at MOTC. These are interesting, but they don't have the human data that tesamorelin and retatrutide does. So if you want to figure out how can I get rid of this visceral fat, is tesamorelin and retatrutide, is that the right stack for me, or tesamorelin tirzepatide? The first place you want to go is go to agelessfuture.com. All you need to do is set up a free intro call, and my team will ask you what your health goals are. We'll build your personalized operating system through a process called the Health Span Assessment. And then once you have that protocol, then you'll have all the lifestyle pieces in place. You'll have a fitness advisor, a nutritional advisor, and then you have a very specific roadmap. And if you're somebody who wants to go deeper into their health journey, I'm going to invite you to come to one of our longevity retreats. Come to an event, learn about all these cool things going on, get to meet some of the coolest people on the planet. All you need to do is go to agelessfuture.com, hit the events link, and you can register right there. I'm Regan Archibald. Thanks for being on the channel. I'll see you in the next movie.